Good afternoon, everyone. My name is Julio Barea, Vice President of Sales for Ally and Care Time, and today we're in session 4 of Speaking Your Referrer's Love Language. And today I'm joined with my partner and usual partner in crime, Debbie Miller, owner and
Hello,
founder of
everyone.
52 Weeks Marketing. Hey, Debbie, how you doing?
Good. I'm
Good.
excited about today. I love this topic about messaging.
It is a very good topic, and I'm a big fan of it. Before we get started, let's talk about what our next event is going to be. And I want to thank everyone for joining today. The event has been growing every time we do this, so we'd love for you to come back and tell your friends about it. We'd love to have anyone who come on this webinar and learn more. The next one will be Wednesday, August 14th at 12 p.m. Eastern, and we're going to be talking about Call to Care, Mastering Assessment Conversions. This is basically talking about the process of understanding how many of your referrals, how many of your leads are turning into assessments, which is turning it into a client, and conversion rates to strive for. What do other businesses similar to you have as their good conversion rate? The process of tracking that referral from start of care and beyond, and then best practices for converting inquiry to cost and assessments. Debbie, I'd really like to hear what your thoughts are on this when we get to that point. So super excited to have it.
A lot to cover in a half an hour, but I'm going to do it.
You cover more information in 30 minutes than anybody I've ever met. I'll tell you that. It's really well done. So today, we're going to talk about relationships. And I think that this is probably my favorite topic in general. Debbie's going to share her business-to-business methodology for developing relationships with referrers, right? Market research results, working with healthcare professionals, how to determine your referrer's love language, and then messaging for healthcare professionals. Really exciting information that we're going to cover today. And I was thinking, and you and I chatted about this a little bit before the show, this whole concept of love language, relationship selling. Men are from Mars, women are from Venus. We actually, Debbie and I were talking before the call, folks, and we didn't realize that book had been written back in 1992. So for those of you who may share a generation with us, you may remember when that came out. And this concept of understanding that we all speak different languages based on our role, whether it's a gender role or a work role or professional or whatever it is, it's all very, very different. And I think in today's business world, there is no other marketing or way of working with other people than through relationships and understanding. I think for a good professional these days, where you want to do business with people you can work with and like, and you want to provide good outcomes for your clients, and they want to provide good outcomes for their clients, you have to speak in a way that they understand. You have to come together. You have to approach the relationship as in not what you can do for me, right? But what can I do for you? Genuinely mean it, and then deliver on it, right? Once you've reached that agreement, those things are really essential. And for me, there was a big change from prior roles. I used to work in business and finance and banking is a bit of a more aggressive type of sales process. And I was curious, Debbie, I know that you came from pharmaceuticals, very similar to the background that I have. Where and kind of how did you make that change to where you realized that relationships and were really the way to drive business growth?
We were very quota focused in pharmaceuticals, and we had to see so many doctors per week with, I mean, that at the time we launched Celebrex, we had to see one doctor 28 times a month. Think about that. With your samples and all of that, because it was a blockbuster launch. And you think about how many, you only have 20 selling days in a month. So that means that you had to see, a doctor more than once a day. It was crazy. So what I really did is recognize, what can I bring of value? It was really focusing on, what can I do to make your job easier and the staff's job easier, and really develop that relationship to where they saw me as a partner in managing their patients. And so I started to do more education, bringing educational tools and things like that, which you'll see me carry through our whole 52 weeks methodology. It really came from that point where I decided, look, I've got to be different from everybody else, because everybody else is trying to call on the same doctor with their drug and so on. So it was just really about understanding what they needed to manage their patient population and what can I do to help them.
That's really good to hear. It's interesting for me. I used to work for a company years ago Sage North American. I sold payroll. When I had this very large prospect, they were a Fortune 500, huge company, and they were interested in doing payroll with us. And I worked a huge quota-driven environment. I think I was shooting to be number one salesperson that year. It was that kind of place. And the CEO of that company wanted to use our payroll product. And after reviewing the information with them, I said to him, "We're not a good fit for you." And he's like, "What do you mean?" I said, you will not be happy using our payroll product. We're not quite the right fit for you. Give me 18 months and we might be a good fit for you." And he said to me, he goes, "I want to do business with you right now." And I said, I'm not going to give you a contract. You're not going to be happy." And needless to say, I just about lost my job that day from my CEO for turning
Right.
that business. I will say this though, that guy, that CEO of that other company pursued me for 12 months. And at the end of
Mhm.
12 months, we did sign an agreement with them. And it was one of the biggest agreements we'd ever signed in the company. I mean, he told me over and over, nobody's ever told me no before because it wasn't a good fit. But that moment to me was really essential in learning that if you genuinely engage with people with the interest of doing what's good for them, you
Right.
are already going to stand out far and above anybody else they work with. So I'm really excited. I've learned with you, it's been exciting because you operate that way from the very first minute I got to know you. So really, really exciting stuff. So on that note,
All
you wanna get
right.
started, jump into it. Oh,
We
first,
were
let's
going to
ask a
do a
survey
survey
question.
question.
Okay. So would you guys like to continue with Marketing Moments series through the end of the year? This is a poll. Please answer it. Debbie and I would love to do this through the end of the year. We've only planned out through August, but we would like to provide something every month. So if you guys are interested and, oh, thank you. Thank you so much. That's like 100%, Debbie. You see that?
Awesome. All right. I guess it's a done deal, Julio.
All right. For the powers that be that are watching this video, we're coming back to you. We're going to do this for the rest of the year. Thank you, folks. We appreciate it. All right. So on that note, I think,
All right.
Debbie, I'm going to pass it on to you.
Okay, well, thank you. So, yeah, so Julio kicked things off talking about relationship marketing, and certainly within this industry, it is very much a relationship marketing concept or model. And so when we think about developing relationships with those folks in our communities, we think about referrals really being generated by those folks who are engaging with seniors and their families, and we talked a lot about that last week. And it's through those relationships, and the relationships come from frequent touch points, right? We've got to be in there. We need to be seeing them on a regular basis and developing and solidifying that relationship to where we develop a true partnership with them, where they see us as an integral part of that care continuum. And that's where the rubber hits the road. That's where somebody that's been in business as long as I have really have incredible partnerships now throughout the community, where folks really see us as a partner in managing their patient populations, like I said earlier. So it's a pretty awesome thing when you get to that point. Now, so here is the methodology. This is just a quick refresher. The business to business marketing system and the methodology that we use, it is to help you develop relationships. And so what you want to do is to be reaching the right people, right? Targeting those influence centers and the right positions within those buildings that are going to move the needle for you. Get your phone ringing because they're the ones that are engaging with those families at that point of need, at that crisis point. Now you need to be seeing them often enough, and in most cases, it needs to be weekly. So that's something that you definitely want to be staying top of mind. A lot of these folks have weekly needs. So if you're not there on a weekly basis, it's going to be your competition that gets that referral. So it's really important that you show that consistency through that frequency. And that's what really starts to develop loyalty, right? So we can have consistent solving the problems that they have. We're going to get into that in a lot more detail today. And then holding your team accountable. So it's reach, frequency, consistency, and accountability. All right, when we talk about reach, talking about the right places, we want to be targeting those folks again where those seniors are in need and their families who are often the decision makers, and then the right people within those buildings with the right frequency and ultimately the right message. And that's what we're going to be focusing on today. So when we think about message, I like to think about it as their love language. What do we need to be talking about to resonate with them, to really connect with them? And so what you want to do is ensure that you're doing what you can to understand your referrer, all right? Not just that them and their position, but the patient population that they serve. What are their patients' needs? What are their challenges? What is that referrer's challenge in managing that patient population? What are their pain points? What motivates them? So all of those things you want to be thinking about as you are considering your messaging strategies. And then, of course, your messaging needs to really demonstrate that you truly understand them. And like Julio said, that you really do care about them. They know when you're authentic and when you're not. And so this is something that you want to work on. They really care about what's important to them, and then find ways that you can help them with the solutions that you can make their job easier. All right, now when we get into messaging, for today's session, I'm going to just focus on those healthcare partners. When we talked about how influence centers across the community, there are three key buckets, right, that we want to focus on for targets. Your influence center partners, your financial partners, and then any associations that you may want to focus on. And then who within those buildings, and then the messaging for each. But today I'm just going to focus on those health care partners. All right. And so I really challenge you, or I want to motivate you to take it upon yourself to understand your referrers. And what do I mean by that is schedule a time with them, schedule a meeting where you can really sit down and be authentic with them and say, look, my goal is to help seniors live their best life, right? So from your perspective, what are the biggest challenges your patients face that affect their quality of life? So really hear it from the horse's mouth, what they feel. And I'm actually going to share some market research that's going to give you some insights. But I really encourage you to go ahead and make those appointments with your own referrers. They will appreciate you for really wanting to sit down and understand who they are and what their perspective is on things. You can ask them to help you understand how you can best support them. What's your biggest challenge in managing your patient population currently? I'm going to show you a demonstration of what an outcome that happened to me recently when I asked somebody this. And then how many of your patients would benefit from home care? Get an idea of how they feel about home care. And is there anything that gets in the way of folks getting the care they need? So understanding what it is, what's blocking them from making a referral. When you understand that and can tackle that, get that block out of the way, you're going to turn on that faucet, get the referrals flowing. So if you don't know, you're calling on them on a regular basis and nothing's happening. It's time to sit down and find out what the issue is. So back to that whole understanding what I can do to support you. I had a meeting with a whole team of folks at a continuum care facility. This was, they had skilled nursing and rehab, assisted living, memory care. All right. And so I had a meeting and I asked that question. And so I got an email. The director of nursing actually went away. We had a little bit of a conversation where she said, what's one of our challenges is that a lot of folks in memory care and assisted, and even in skilled care, they think that their loved one is going to get all of their needs met. No matter how much care that person needs, they think and expect that their staff is going to provide everything that their loved one needs. And she said, so I struggle with when I have to make a recommendation for some additional care, say from your service, Debbie, from your service, I have a hard time with that conversation because they think that my staff should be able to do it. And so then I feel like they feel less of my staff and my organization. She said it would be really helpful if you created a flyer or something that talked about some of those key situations where I have to recommend some additional help, whether it's on site or whatever it might be. So she went away and she thought about it. She sent me this email and she said, because I said, well, what are some of those things? And she listed them: high fall risk, confusion, behaviors, anxiety, impulsiveness. She came back and said to me, this is what would help me do my job to sell your services. So
Wow.
what did I do with that? I made a flyer. I took her exact information and I put it into action, and I created a flyer that we are now using all over our community with all of these types of organizations. Because if she's struggling with it, so are our other director of nursing, having these conversations with families. And so what do I say here? It's balancing specialized care that they're receiving wherever they are, whatever facility, and one-on-one care. And so I listed all of those particular scenarios that she outlined for me and so that they can have this conversation and say, hey, here, your mom falls into this category. She would benefit from additional one-on-one care from, in this case, senior helpers. So I wanted to show you the power in really truly understanding what are some of the challenges, and then bringing in an answer to that challenge. And so she was so appreciative, and now we're using this in all of our facilities across the country. So I just wanted to give you a real life example of how I was able to put this into play. All right, well, I'm going to share some market research. I am so excited to help you all and give you some insights from this feedback that we received. We did a survey of just under 1,000 healthcare referrer types. Okay, and I'll show you a summary of who they are. And we had about a 25% response rate. It's amazing what a $300 gift card will render you in terms of a response. It was really awesome. And so my goal was to better understand their perceptions about home care, what their perceived role is in referring to home care, and then what is the relevance of improving outcomes? Because this is kind of the big buzzword, right? Reducing readmissions, reducing hospitalizations, improving patient outcomes. I wanted to know how relevant was that topic to them in their roles. Also, I wanted to pursue what their level of willingness to develop a relationship with a home care partner. And then what is it going to take to build that relationship or ultimately partnership? So I'm going to share the results with that. Now, here are the categories. So on the left-hand side, you see the influence centers that responded, and then the roles within those influence centers. So we had director and managers, we had discharge planners, marketing and salespeople, DONs, social workers, doctors, nurse practitioners, and therapists. All right, so from a wide range of healthcare organizations. And so the first question I asked is, do you believe that there will be an increase in the need for home-based care in 2023 and beyond? We did this, I think it was in November of 2022. And they said 97% of them said yes, that they felt like there was going to be an increased need for home care. And then I said, okay, why? Why do you think that? And these were the top reasons. They had a whole selection, and these were the top reasons. The top one was population is aging, more people need care. No surprises. They also said seniors prefer to receive services at home. So that's interesting. They recognize that the desire is to stay at home, and that primary caregivers need help, and that money was definitely a factor. So they saw this as being a cost-saving model. Okay. So then I said, in your opinion, how does a senior care provider best help your patients age in place safely? So what were the things that they thought we did the best around keeping people safely at home? And so they could select more than one of these factors. So, and I'm going to give you the percentage. So 82% admitted or agreed that assisting with ADLs was one of the best things that we do to keep people safely to age in place. Medication adherence was important. Assisting with IADLs, such as grocery shopping and house cleaning, that was listed high. Case management, this was really interesting. Resources and recommendations for other community services. So they thought that that would help folks age in place, chronic disease management, and then finally companionship was down there. So you can see that those top ones, well, some of those things you may or may not be talking about. And that's something that I'm starting now. I think you probably can see where I'm going here. These are things that you want to include in your messaging because they believe that these are things that we can best help folks age successfully wherever they call home. All right, so now we're going to get into the outcomes piece and see how important that is. So I said, how focused is your organization on improving outcomes and reducing hospitalizations? And so there were 4 options. Is this a major priority of your organization? Is it a priority, a somewhat of a priority, or not a priority at all? And here was the feedback. 62% major priority. 23% said it is a priority, and so on. So when you're looking at, 85% of folks said this is a priority for my organization. So again, messaging, right? We want to be talking about home care, how home care can help them improve patient outcomes. Because at the end of the day, they're either being penalized or rewarded based on patient outcomes. That's how serious this is. So for a skilled nursing facility, hospitals, home health, and even hospice, they are now being measured on patient outcomes, and they're being penalized or rewarded based on those. So they're going to be looking for partners who are going to help them increase their patient outcomes measures. All right. So those are things that you want to be talking about. So then I said, or asked the question, do you believe that senior care services provided at home can help improve your patient outcomes and reduce hospitalizations? Wait till you see the results of this. What do you think the percentage is that folks thought that this was important? Just
We go with 70%.
70%? 100% said yes. 100% of folks surveyed said they believe that home care could help improve outcomes. Wow. Can you imagine if we got 100% of those referrals?
That's amazing. That's
Yeah.
an amazing number.
Yeah. So there's a disconnect here, right? There's a little bit of a disconnect. Like when you think about hospital discharges, are we getting 100% of those? Absolutely not. So we've got to look a little bit deeper and say, okay, what is it? What do we need to be doing? We need to be talking about it for sure, and reminding them about what we can do to help them with their outcomes. So I asked the question, would your organization benefit from a home care partner to support your senior population? And here we go, 65%, yes, we would benefit from a partner. Okay, so tons of opportunity for you home care providers out there, right? They're looking for a partner. They believe that it would be beneficial. So then I said, well, when recommending a care provider to help your senior population, what factors would cause you to choose one provider over the other? And so they could select several of these, and this is the priority based on the responses. Good reputation was number 1.
That's important.
They wanted to have somebody with a good reputation. They also, what was important was somebody that was communicating with them on a regular basis. Remember those touch points I've been talking about? Also, people that could alleviate stress from them and their patients and families. Interesting. Also, solving patient problems. These are very linked. It was really interesting. That was like, one-stop shop. So they can make one referral and have that patient situation taken care of. Also visiting regularly. This was kind of similar to communicating regularly. We also have they're visiting them regularly. And then finally, provide educational information for their patients. So that was an important factor that would differentiate and persuade them to lean toward one organization over another. Then I said, how motivated are you to make recommendations to your patients and their families to get home care? And so these were the 3 options. So 46%, look at this, 94% said they're least motivated. So this is all good news, right? Like they, and I don't know if I can't remember where, I think maybe when I was talking to your team, Julio, I feel like home care has been sort of the ugly stepchild for a long time. And so because of the importance of improving patient outcomes, because we can do so much to help them in this home-based care model, they are more motivated. They're going to be more motivated even in years to come because they're being more scrutinized on these outcomes. So we have a lot of opportunity to partner with them. So what would potentially keep you from making a recommendation to a patient or family about senior care services? So these are the things that get in the way. First one is, I don't know anybody I feel comfortable recommending. Wow. Big opportunity to develop relationships, right? They're eager, they're willing. It's just getting in front of them, making those contacts and building on that relationships. And then they say, I don't have time to make recommendations and follow up. So again, if you can make that referral process really easy for them, they're more apt to do it. Also, they say, were you gonna say something, Julio?
I was gonna say, make it automatic, make that more
Yes.
automated, bring that
Yeah,
automation to it.
right. I don't think my patient or family will act on my recommendation. Yep, not everybody's teachable. We understand that. I don't think they can afford it. This is a big one, all right? Big block, and that's something that you definitely want to tackle. If you if you accept other payer sources, this is something you definitely want to focus on, and to indicate that there's a lot that you can do to help them tap into other payer options. Big message that you want to be delivering here. I've had previous issues with providers. They may have had previous issues with you, all right, but you don't want to sweep it under the carpet and ignore it. You've got to address it. Say, hey, what can I do to get this back on track? Got to address it. And then I don't know how to connect patients with providers. So that's all, again, just about not having a relationship. So all this, let me just summarize this, is they believe there's a need for that's going to increase. They think home care is beneficial and can help their patients age in place. So focusing on the ADLs, the medication management's a big one. Number one reason people end up back in the hospital. Case care management. Give them the idea that you're a one-stop shop, that you can take them from A to Z, get them linked to resources that they're going to need, etc. If you do a home safety assessment, that kind of thing that will help them to see, hey, you really are going to take them, help them manage their chronic condition better, those kinds of things that, again, lead to hospitalization. Definitely want to focus on improving outcomes. That's a high priority for all of these folks. And they're going to be more motivated to recommend you. So you've got to build on your reputation, talk about, the extra things that you do for your clients, have those frequent touch points, be connecting with them on a regular basis, bringing them some value add education. Though all those things can really make a difference. So I want to share, I kind of want to bring this all together. And Dylan, my director of business development, he's also the coach for many of our clients. And part of our onboarding is we do a pretty extensive coaching for folks when we bring them on and start with them with the system. And so one of the newer guys that's working the system sent him a text. And he wanted to give him an update on how things were going in the field. And I want to share this with you. So it's you'll know where I'm going once I get through this. So he sends him a text and he says, hey, Dylan, good week so far. I've gotten into 4 rehabs that wouldn't give me the time of day last time. Now the gatekeepers just tell me where the social workers' offices are and tell me to go ahead. So this is how it went with one of the rehabs today. I was stoked after this. So he says, I'm paraphrasing only slightly. So he says, me, standing at case manager's desk. Do you have a few minutes for me? Her, maybe. What do you want to talk about? Me, reducing readmissions. Her, sit down. So it just goes to show you when you're bringing that message that's resonating with them, that's addressing some of their pain points, which in her case, hey, I'm all about reducing readmissions, and then she was willing to give him the time of day and actually got that face-to-face time. So I thought that was just a really good example of speaking her love language. And so I wanted to share that. So when we've got a very extensive tool here that we are making available to anybody that is attending this workshop. And what we've done is we've outlined all the key influence centers along with who you want to target, and then the message that's going to resonate with that particular referrer. Okay, that particular person in that position, say it's a social worker at the hospital. So this is an amazing guide. You can, we're actually going to give you a survey question that you can fill in if you would like to receive that. So just hang tight. You don't have to do anything yet, and we will email that out to you. We just don't have time to get into all of the extensive messaging for each referral type, but we've got it all laid out here in this awesome tool. So I'm going to turn it back to you, Julio, and we can summarize everything, and then I will wrap it up.
Perfect. Thank you so much, Debbie. I appreciate it. Fantastic slides. Really, really exciting information. Some of those statistics really took me by surprise, Debbie. Really, the 100% on that one is a really eye-opening number. It looks like some of the folks on the comments are also really getting some information out of here, really enjoying that. Do we have another slide here? Let's kind of go to the next slide. I think one of the things here that I think I took away from it was when trying to speak and understand what you can provide to other people, it's to listen, right? The story that Dylan told about that he let that client of yours landed on exactly the right thing. And it really needed no further explanation. He just said, this is what I can offer. It helps hospitalization. That's the number one thing they had. I would say if anybody took anything from this, it's listen to what your referrers are telling you or what your referrers want, or learn what Debbie is telling you referrers are telling other people that they want to hear. And just provide that. Just give people what they ask for, and they will work with you every single time.
And again, don't be afraid to sit down and say, look, help me better understand what your challenges are on a daily basis. I don't want to waste your time. I would really prefer to know how I can bring value to you, what I can do to support you. They will appreciate that so much.
Yeah, I think listening to people is probably the biggest part of any business conversation at all. I agree with you 100%. Here, the same thing. Every conversation we start as a client is tell me what your problems are, tell me what you need. And if we have a solution that can help you, we'll work with you. And if we don't, we'll tell you up front and we'll move on or suggest somebody that can help you. And I think when people know that you're you're trying to grow your business. Let's be very honest what we're doing here, but growing your business in the right way and showing people that you're doing business in the right way is going to put you in the 1% of business owners out there. I promise you that, as someone who's owned their own business and worked with many other businesses, doing business in the right way, doing what you say you're going to do and listening to what people want and giving them that, you'd be surprised at how few businesses actually do that. So you could be a huge standout in a market. This is really good information. So Mark and Canada has a very long question here, so I want to address it if we have just a couple more minutes. Talking about family caregivers and the hours they might much need, caregiver burnout. That's a big thing, and because Canada is a public system, clients don't pay out of pocket. Home care is by multitudes the best bang for the buck. How true, Mark. Really, really true. And we have, as part of our organization, we have a company in Canada, and we are aware that things are a little bit different over there. But I agree that this process, it doesn't matter if you're in the US or if you're in Canada, or it doesn't matter what country or what market you're in. Really working with people and asking what they want and providing what they want is going to be successful.
Yeah, I don't know if anybody's caught my accent, but I'm actually from Canada and born and raised in Hamilton, Ontario. And I understand that it is a much tougher system, especially to be marketing in, because Canadians just by nature expect things to be free, anything related to care and unfortunately the system, yes, it provides a certain amount of care, but it's typically inadequate care. It's an inadequate level of care, right? You might get an hour or two, and somebody needs 8 to 10 hours. So it's a tough one. But at the end of the day, when we've got the burden of care in both countries, whether you're in Canada or America, is so it's so challenging. It's rising. We've got 54 million caregivers in this country. The average caregiver will provide 22 hours of care a week. 25% of caregivers will provide 44 hours a week. That is a huge burden on them, and especially for spousal situations where they're older, taking care of the older. So it's one of those things where if you can help your healthcare providers understand the burden that families are carrying, and if they could recommend another option that will build on what they're already getting, say from the healthcare system, help the healthcare providers make those recommendations to the families to say, look, you're going to burn yourself out. By the way, 61% of spousal caregivers will die before the person they're caring for. That's when the whole house of cards comes falling down.
That's a
So you
scary
go,
statistic. That's a
yeah,
scary number.
right. So you go in with stats like that and educate them about how important it is for the healthcare providers to intervene and advocate for those family caregivers and make those recommendations. Now, of course, not everybody can afford it, but those that can, it can improve their quality of life so much.
Great. Thank you so much, Debbie. We have one more question, and forgive me for the pronunciation, but I believe it's Kayer Shaw is asking, what advice would you have someone just starting out with a new agency on getting time with healthcare referral partners to understand their specific needs and their pain points? I'm going to give my answer and hand it to Debbie. She's the professional.
Go ahead.
I'm going to say, just ask for it. Give them a phone call, give them an email, knock on their door, and ask for it. What do you think, Debbie?
Absolutely. And it's going to take more than one phone call and one knock on the door, because these folks are very, very busy. But what I would do is I would call, leave one message, and never leave a message again. Keep calling until you get them on the phone. You can pick up their cards if you're just starting out. You can pick up their cards typically at the front of, say, a rehab center. You can get the therapist. I like to start with the director level, and believe it or not, they're often easier to get time with. So if you can meet with the director, and then once you've developed a little bit of a rapport, ask for an opportunity to present to the whole team. The director will go ahead and get that organized for you. So that's one option for you to do. I would definitely say connect with Dylan if you want to get started with the 52 weeks program. It's great for somebody that's just starting out. We help you get targeted and get your route, get organized, coaching, etc. So there'll be some more information on that in a minute to get you connected.
Thank you, Debbie. I would definitely say this, and I'm not saying it just because this is what we do for a living, but if I was starting an agency today, I would get a software like CareTime to make sure I ran my business well, and I would work with Debbie and Dylan on 52 weeks marketing 100%. I wouldn't even think about it twice. It will save you an entire learning curve of trying to figure out, I'm a big believer in not reinventing the wheel. If somebody has already figured it out, I'm just going to do what they do. And not try to reinvent the wheel. And I think that's a great way to work. That's fantastic. The last question here, and we'll move on, is can we get info on Reach and the healthcare professionals from past sessions? I think my best answer there is what we answered before. Everything that we have, every webinar that we've done is recorded and on the CareTime Resources website. We can send out copies of the messaging guide. Would everybody like that? I'm going to figure that's 100%.
Oh, wow. Look at this. 100% of people want the messaging guide.
I like these 100%. Honestly, if I get 100% in the next two questions, it's going to be a very good day.
Yes.
Let's go to the next question. Would you like information on how 52 Weeks Marketing can help you create a business-to-business system? Very good. Fantastic. Thank you so much, folks. We really appreciate you guys doing under. Debbie, look like you've got about 38 folks there that are interested in talking to you guys. And would you like information about how CareTime can help you track and communicate your patient outcomes and hospitalizations? Let us know. I have a few no's. It's okay. I won't take it personally. I understand. Perfect. Thank you so much, folks. Super excited to have you guys reach out. So I think we'll finish up with reminding everyone about the next one on August 14th. Maybe we can pop back to that slide that one's at 12:30, I believe.
No, it's at,
12.
yeah, same
12,
time.
12 EST on Wednesday, August 14th from Call to Care Mastering Assessment Conversions. So we're
It's
looking
a good
very much
one.
to it's a good one. We want to have you guys there. You guys keep coming. We'll keep doing these. Debbie, as always, it's a true pleasure working with you. Thank you so much.
You too, Julio. Bye for now, everybody.
Bye, folks.